Hello, my name is Lisa Cawthorn. I'm here hosting Focusing on You, sponsored by Hope Abounds. I'm a patient advocate that works with Hope Abounds. I'm also a breast cancer survivor. And we're here to present an educational program about hospice, which can sometimes be a scary topic for people. But I do want to reassure everyone that this is informational. We hope it will help you or someone that you know. With me this evening is Dania Armstrong. She is an LPN and a hospice care consultant with Community Home Care and Hospice. So welcome, Dania.
Thank you. Thank you. It's a pleasure to be here.
Good. So this may be a very tough topic for some folks, but a very important one. And one way I always introduce this when I'm talking to my friends or patients I've had interactions with is I say, one thing is certain in life, and that's that we all die. But today's program, we're really focused on quality of life at a stage in our lives that's often hard to think or even talk about. On your promotional material for Community Home Care and Hospice, there's a slogan that's quite meaningful, and the slogan is, "When life matters most."
Yes.
So could you tell me what the mission of Community Home Care and Hospice, part of Curo Health Services, is?
Yes, our mission is to provide the patient and family members with quality care and compassion at a time when they are really facing a life-limiting illness.
Okay.
Yes.
And so what is your role with this organization? Your title is Hospice Care Consultant.
I know it's a big title, right? And what it really means is my role is to want to educate about hospice and what it really means, because people are, as you said earlier, afraid of that word. They hear hospice and they go, oh my God, it's the end. So my job is to educate about hospice and what it means and the services that are available. And I talk to organizations, I go to the hospital, I visit doctor's offices and try to get them to understand about hospice and then refer those patients to us so that we can help them through this journey.
Excellent, excellent. So what communities do you serve in North Carolina and other states?
Well, we have offices in 23 different states in the United States. And then in North Carolina, we have a lot of different offices. And the best way to find out what services are in your local area is to go to our website. And then that would pinpoint you to your city and let you know what's near you.
So our organization, Hope Abounds, is here in Wilmington, North Carolina, but we do serve more of North Carolina than just the Wilmington area. And I noticed when I looked at the website, there are a lot of drop pins
Yes, it is.
for where your organization is. So in order to find out if there was a hospice serving a community, how would they do that?
Yes, the best way is through our website.
Okay.
And it will tell you to go to your state, and then it'll tell you pick a location, and the drop-down menu will bring down different cities.
Okay.
And you just plug in your city, and voila, there it is.
There it is. And it
Yes.
would be a specific phone number for the region that you're in.
Right. It goes right to their office in that city.
Even if there's people that aren't in North Carolina and they might be in another state
Yes.
somewhere, they could just look
Pick
it up
it out.
by
South
state.
Carolina can just go to South Carolina and pick out their state and put their city in, and the menu will drop it down for them.
Great. Okay. Great. So that's sort of the locations that you serve. What sort of age population do you serve in hospice?
Right now we are focusing on the adults.
Okay.
And providing care for them.
And you're here in the Wilmington area, is that right?
Yes, we do. We serve Brunswick County, New Hanover County, and Pender County here locally in this area.
Okay, great,
Yes.
great. So let's get back to the number one question. What is hospice? What is the philosophy of care of hospice?
What hospice means, it means quality of life. It's not about dying, it's about living. And it's about focusing on that person as a person and not as a disease. So we don't see the disease, we see the person and their family, and we're providing support for them. And hospice is a way of looking at this journey that, you know what, I'm going to be surrounded with those who love me and care about me, and they want what's best for me as well and for my family. And I think that gives that patient that peace of mind in knowing that whatever time I have left, I'm receiving the best care possible, and so is my family.
Oh, wonderful, wonderful. So when you talk about the care, where does the care take place? Where does hospice go, or how does that all happen?
Yes, because people think of hospice as a place. I have to go to hospice. But hospice is actually a service. So where the patient is, that's where we go. They can be at home. It's really wherever they call home.
Okay.
So at their house is home. If they're in an assisted living facility, a nursing facility, wherever they may be, that is where hospice goes.
Well, that's important because I know maybe it was a decade ago, it was only for the home.
Right.
And they expanded those services so that if you were in a skilled nursing facility, that you could still get hospice care. And I know with my mother, she was in a skilled nursing facility, and she initially maybe didn't know so much about hospice or what hospice did, but the care was outstanding because a hospice nurse came in, a social worker,
Yes.
a nursing assistant, and all gave her additional specialized care,
Yes.
even though she was in skilled nursing facility. And
I think for the family, that means a lot too, because besides just having the staff facility there looking after your mom or your loved one, you will have our team to come in.
Right.
So the family has that extra set of eyes and ears to look after their loved one, and that brings them an extra layer of peace too.
Yeah, that's really wonderful. And then you said it's sort of a philosophy of care. It's not a place. But what about if someone needs something a little more? Are there inpatient facilities for hospice, or how does that work?
Yes, there are inpatient facilities available. Here locally, we do not have one here,
Okay.
but we are contracted with different nursing facilities that allow us to provide that care if the patient so desires. Most of the time, the patient desires to be at home, and we are able to keep them at home and keep them comfortable.
Excellent, excellent. So then who qualifies for hospice care?
Anyone who has a life expectancy of 6 months or less.
Okay.
That does not come from hospice, that comes from their physician.
Okay.
And what the physician is saying is that he would not be surprised that within 6 months that person's life ended. He would
Okay.
not be surprised. He's not saying that it's going to happen in exactly 6 months. And then that allows us to come in, and then we talk to the patient and to the family about our hospice services. So if someone has a diagnosis of renal disease, a respiratory disease, HIV, dementia, and of course the different cancers, then we are
Okay.
able to come in and provide that care for them. And they do qualify for hospice.
Okay, so even though our program sort of focuses on cancer, hospice is not just for cancer
Not
patients.
just for cancer. No, ma'am.
Great. And so if we focused a little bit on the cancer patient, less than six months or less, sort of as a rough time estimate that the
Right.
physician is designating a cancer diagnosis. Is there any other criteria for a cancer patient? Are they allowed to get hospice care if they're on chemotherapy or radiation, or what sort of things would they be able to do and not be able to do?
Well, going back to the philosophy of hospice, it is about the comfort.
Okay.
So if a patient is at a stage in their life where they feel they would like the curative measures, they would like to receive the radiation and receive the chemotherapy, then at that time they may not really be appropriate for hospice services because they are focusing on the curative part of it. When that patient decides they no longer want curative and they just want comfort care and not the aggressive treatment, then hospice may be more appropriate for them at that time.
I understand.
Yes.
Well, what about, I've heard that a cancer patient might be able to get radiation while they're on hospice care. How would that happen then?
What happens in that instance is most likely the patient is getting the treatments because they're having some pain symptoms. And so those treatments help to alleviate the patient's pain and allow them to have a better quality of life. And so they know it's not to cure them or make them 100% better, but it's to allow them to have a better quality of life for the time that they may have left.
So it would be given for comfort reasons
comfort measures.
Versus curative
Exactly.
reasons. Okay.
Exactly.
All right. So a lot of times we hear that that someone may be within days or weeks of dying. But when do you think, or when can hospice come in? At what point in someone's life could hospice come in?
What we find is that when that person gets that diagnosis of a terminal illness, it is to their benefit to really try to start hospice as early and soon as possible. People, often hesitate, and they may wait until those days and weeks come about before they ask for the hospice care. But if they call us early, then the benefits are they get 100% of all the benefits of hospice, and their family members get the extra support, and they get their pain managed a lot better. Their symptoms are under control a lot better and a lot longer, so they can enjoy that time that they have with their family, without being in so much pain or without having to worry about what's going to happen to me next. So the earlier, the better, and it really is for the patient's benefit.
Well, that's nice to hear. I wish I could recite some research articles, but I do know that there is research that proves that once someone is more comfortable, that actually they live longer in some cases.
Yes,
so that would be another key reason as a side benefit to have hospice is that controlling that pain. Some people call it palliative care with the symptom management that that would actually help them live longer.
Right.
So circling back to that 6-month sort of timeline, is that a hard and fast rule?
It is not a hard and fast rule when it comes to the care that we give. We're not going to say, okay, it's 6 months and 1 day, what's going on here?
Okay.
As long as the patient has a diagnosis that qualifies them for hospice, they can stay under our services as long as they need us. So it may be 2 years, 3 years down the road, and that patient is still with us, who is now a family member to us because we've had them for so long. But they're able to stay under our services for as long as they need us and they qualify.
So here's a doozy question. Do people ever graduate from hospice and come off of hospice completely?
Yes, they do, because getting us in early allows us to manage their medications and their pain, and they start to feel better. They want to eat more, they want to get out more, and before you know it, we're like, well, you don't really need us anymore. You're doing pretty good. So patients often do graduate from hospice and do very well. Yes.
Great. So here's the money question for you.
Yes.
Who pays for hospice?
Hospice is covered 100% under Medicare and Medicaid. So patients who have Medicare and Medicaid are covered. So their equipment that they may need, the medications that are related to their diagnosis, anything they need that is related to hospice is covered 100%. So they have that peace of mind of knowing I have no out-of-pocket costs by having this service. And I always tell people, you worked hard for this. You paid your taxes, you paid your dues. This benefit is here for you. So why wouldn't you want to take advantage of that
Right.
and bring that peace to yourself and to your family member by getting hospice services?
So, what's the process for referral? Do you have to commit to hospice if the doctor says to you or to your family member, I really think you should think about hospice? So, what is that process? Or even if a doctor hasn't said anything to you, but you're sort of interested in what it is. So, could you lay out the process for us?
Yes, if a doctor, says you have a terminal illness and he feels that you need hospice, then often they will call us and give us the order for evaluation. And then we will contact the patient and set up an appointment and go out and talk to the patient, make sure that they're appropriate for hospice and they understand the hospice philosophy and what we'll be doing and what the team approach is. If someone is out there without a doctor and let's say they're home with their mom and they're thinking, I may need hospice services, they can also call us and we can give them an informative visit and just discuss our services and the benefits of having hospice so that they're educated about what we do and who we are and the resources available to them.
Nice.
And then, of course, we can work with them, with their doctor to get in order to go forward.
And how quickly would you be able to see someone in the community?
We can often do it the same day.
Wow.
Or at least within 24 hours, we can see that patient and get them on board.
Oh, and then hospice would order the durable medical equipment
Yes.
and bring that into the home and then take care of any medicines that would need to be
We
ordered.
would take
that
care
kind
of
thing.
everything. The patient, the family just sit back and relax, and we do all of the heavy lifting, as they say,
Good,
and take
good.
that burden and worry off of them.
Great.
Yes.
So what's the advantage of hospice versus regular home health care?
Well, with hospice, I think one thing that patients really like is that we are available to you 24 hours a day. So if it's 2 o'clock in the morning and your loved one has fallen or is having increased pain or something's just not right, you can pick up the phone and call us and we'll come out. A
Wow.
real nurse will come out and see them and evaluate them and make sure they're doing okay. So we never close our doors. You always have access to our hospice and the services.
So someone is on call and can
Someone is
either
always
talk
on
to you on the
call.
phone or go out to your home, something
Yes,
like that.
exactly.
So, which brings me to my next question. Hospice typically means a team approach.
Yes.
Right? It's a philosophy of care, but it's also a team approach. So, who are the members of the team and what are their roles?
Well, that patient has their own specialized team, and we do have medical directors that oversee the patient care. The patient will receive weekly visits by an RN. If they need more than weekly visits, that is also very possible. They will have a CNA, a certified nursing assistant, that can come out, help them with their ADLs, their activities of daily living, getting dressed, getting bathed, getting shaved. That person will come out 2 to 3 times a week on average, but less if needed or more if needed. They will have a social worker who will make sure that everything in the house is set up for them, that they are safe at home, and they have those resources available. Then they will also have a chaplain, so that if any kind of spiritual needs that need to be met, that chaplain is able to be there to provide that and to provide any bereavement that the family may need. And we have a wonderful volunteer program. A volunteer coordinator will call the patient and offer services. If someone is home and they need to go out to the store, a volunteer can come and sit with that patient while the family member is able to go out to the store, do some grocery shoppings, and not worry about
important.
that patient being home and being alone. If someone just needs somebody to come and sit with them, to read to them, or to listen to them, the volunteer coordinator will arrange that as well. But volunteers are a big part of what we do, and they're really important in providing the care to the patient as well.
So the patient is at home. The family is actually the caregivers for the patient, but you have the hospice team members coming in to help. The RN is looking at symptoms and communicating with the doctor. the certified nursing assistant is helping with the activities of daily living, and then you have the social worker and the chaplain
Yes.
helping with the emotional and the spiritual and the mental needs. And probably they all do some education too,
Oh,
is
yes,
what I
that's
would
very
think.
important. Yes. Any questions that family members may have, what's going to happen to mom now? What is she going to feel later? What about, down the road? Then the nurses and the chaplains, everyone can answer those questions and bring them that peace that they may need. So it is a team effort, and that patient can feel comfortable in knowing that they always have someone that's going to be there to look out for them. And on the same hand, that patient is in the driver's seat. So what they need is what we're here to meet. So they need more of us or less of us, then we are here to meet that need. But each person is treated as an individual, and their care is catered to them specially.
So if you don't want to see a chaplain,
You don't have to.
you don't have to.
No, not at all.
Okay.
Yes, it's up to that
But then if you
patient.
want to see a chaplain more often,
We will come out and see
you
you
would.
more often.
Okay.
Yes.
Good. So when there is a care team, and you've mentioned a little bit of this already, but I want to go back and revisit it. What are some of the quality of life issues that you focus on for the patients and their families?
Well, with the nurses, you want to make sure the patient is comfortable. You want to monitor their pain, any symptoms that they may be having. So the nurse is really important in the patient care portion of it. With the chaplain, again, addressing the spiritual needs that the patient may have. And, even with the certified nursing assistant, they're coming out a lot and spending really close time with that patient. So they're able to see those changes in Mr. Smith. Doesn't look so good. He's breathing a little bit differently today. His wife is saying this or saying that. So that team approach really helps us to kind of zone in on what that patient is going through and meet those needs that the family may not necessarily see. So it is important.
And then the skin issues are very important for someone that may not be as active as before. So although you aren't there every single day, you have someone there to observe changes in skin and maybe offer some preventive guidelines about mobility and turning more and nutrition, those sorts of issues.
Yes,
Is that
we will
right?
definitely educate the family on hydration and turning and skin issues. Whatever that patient is going through, the nurse will educate the family member so they feel empowered as well to take care
Right.
of the patient when we're not there. Sometimes they make better nurses than we do.
They know their
They
patients
know
well.
their patients well, yes.
So, a lot of folks are concerned, like, oh, I'm going to have to give up my doctors if I have a medical oncologist I've been with for a long time, or my primary care. All of a sudden, this hospice doctor is going to take over, and then I'm not going to have this relationship or the team approach from the rest of my doctors. What would you say to people that maybe have that idea in their mind?
I would say, well, guess what? You get to keep your doctor, because who knows your care better than you and your physician? So we value that physician's wisdom and knowledge and relationship that he has with that patient. So we encourage him to follow the patient, and we work with him very carefully. He'll get weekly reports. We'll call him with any changes, and he will always be in tune to what's happening with his patient. So we're not kidnapping anybody or holding anybody hostage. We are definitely working with the physician to make sure he knows what's going on.
Excellent.
Yes,
Excellent.
that's important.
And the hospice physician, though, is available 24/7 too. So the nurse that gets a call either can evaluate by phone or come in person, and she or he
Yes.
can be in communication with the hospice physician. Is that
Right.
correct?
Yes, the hospice physician is always available. So if that patient's physician is out of town or not around, then he can step in and and help out. But it's not about taking over, but it's about supporting
Right.
their physician as well. So we have 2 medical directors, so we are covered very well, and we'll be able to provide that care.
Good.
Yes.
And yeah, I know from going through some issues also with my father, who was in hospice. I'm a big proponent.
Yes.
But, he was having some restlessness and some shortness of breath issues. And sometimes it's hard to be a daughter and a nurse.
Yes, it is.
So I was able to be a daughter and kind of relax in that role, and then call the hospice nurse and tell them what was going on.
Yes.
And they were able to give me recommendations as far as what to do for that. So it's not just pain. Yeah, they walked me through. Yes. Great. So this is a little tough for some folks, but planning is very important. And what role maybe did the social worker and the chaplain have involved as far as end-of-life issues? It's not just the emotional piece. It could be advanced directives, or tell me some of the things that they might work on.
As a social worker will definitely work one-on-one with the patient and the family to make sure issues like advanced directives are taken care of. So she will go through, do you have a health surrogate? Do you have a power of attorney? And try to make sure those things are in place. Have you signed a DNR? But also at the same time, they're educating that family and patient on the importance of having those things in place. So down the road, we're not at the end kind of panicking and, oh my gosh, what am I going to do? So planning ahead is really, really important. It is, but the social worker definitely makes sure that all that is in place.
And that's important for all of us. I always say this. It's important for all of us. And like I said, there's only one thing sure in life, and that is that we will all die one day. It just gives us a little more planning time if we know there's a serious illness involved.
Yes.
But it is something we should all have.
Yes.
Okay. What are some patient wishes that you have encountered that hospice care is able to address?
Patients' number one wish is to be at home with their family. And I think that is something that hospice is able to address and provide. They want to be home around their loved ones. They want to be in a familiar surrounding. They want to have visitors be able to come and go as they please. So they want to be at home, which is their comfort zone. So having hospice in place allows them to be at home and to have that. We've had patients who have wanted a garden, but was unable to go outside themselves and plant that garden. So we were able to help them with that
give them, that's wonderful,
and give them that peace. My grandmother, she was under hospice, and she loved birthday parties. She just loved parties and that celebration. And so hospice was able to help me give her those birthday parties and make it lasting and a great memory for her. So we do tend to kind of spoil our patients and give those little extra birthday cakes and give just that love that they desire to have, that they need to have. But yes, those are some things that we can do.
So having your family around, and sometimes family can be defined as your pets too.
Yes.
So
we love the pets and we love the dogs, and they're a big part of the patient's life. So yes, patient and the pets, they kind of go hand in hand at times.
Great. So actually there's a couple of things.
Okay.
Our audience may not know this, but when I was talking to you, you had a little tidbit of unusual information about yourself that helped me remember you. You grew up in Florida.
Yes.
And you told me you had seen every single
shuttle launch.
Yes,
from the Space Center. I did. It was a great experience. I missed the shuttles, but since 1981, the shuttles started going up. I have seen them, felt the ground shake, heard the windows rattle, and got to see that amazing, amazing thing. So I feel very blessed to have lived on the Space Coast and got to see that, yes.
Well, we're glad you're here in the Wilmington area.
I'm glad to be here, too.
Even though you told me you came and it snowed, and that was just not fair.
I need for it to be 75 degrees and above, and we were working on that. We're getting there.
We're getting there.
Yes, we are. We're getting there.
So, in closing, are there any pearls of wisdom that you can share with everyone watching?
I think what's most important is that someone shouldn't feel afraid of hospice. Want to think of hospice as comfort and as support for them and for their family members. And of course, the sooner the better. For me, having hospice with my grandmother was the best thing I ever did. Was it scary? Yes, it was. But it was the best decision that I made because she received the best care. And like you, it allowed me to be just Dana, the granddaughter, and enjoy that time with her, knowing they had the other part taken care of.
That's right.
So it takes a lot of burden off the family members and allows that patient and them to have the extra bonding and just enjoy each other. So I would say, don't be afraid of hospice. Embrace the care and compassion that you're going to receive.
Well, I think that's a wonderful way to end our interview this evening. And I thank you so much for the information that you shared with everyone. And in order to contact you, how would they do that?
Probably the best way would be just to go to our website, which is communityhch.com. And then you'll be able to find our office and find me, and we will come running to help.
All right. Well, thank you so much, Dana.
You are so welcome. Thank you for your time.
All right, then. And that's it for our informative session this evening for Hope Abounds. We're glad you joined us and hope you learned something that will be comforting and helpful for you or your friends or your family. And look on our website at hopeabounds.org. We also have an app if you want to find us there. Thank you very much.